Now let's talk about bipolar disorders. This can be asked as a 4 marker in our university examinations. And I have taken my points from Manipal Manual for Medicine, Mandapa. So let's see what are points you have to mention if it is asked as a 4 marker. Let's start. What are bipolar disorders? They are characterized by episodes of mania and depression, which may alternate, although many patients have a predominance of either one of these. So they are having episodes of mania and also depression, which may be alternative, but although many patients have predominance of one or the other. Etiology factors, genetic factors. Bipolar disorder is strongly heritable, and there is also evidence of dysregulation of serotonin and epinephrine. Serotonin, norepinephrine. There is also evidence of dysregulation of serotonin and norepinephrine, and stressful life events and physical illness may trigger the episodes. So 3 points: genetic factors, and also dysregulation of the serotonin and norepinephrine, and stressful life events and physical illness. These all will trigger the episodes of the bipolar disorder. And also some drugs, cocaine, amphetamines, alcohol, and some antidepressants like tricyclic monoamine oxidase inhibitors may also play a role in triggering the episodes. So etiology, you have to mention the 4 points: genetic factors, dysregulation of the serotonin and norepinephrine, and the stressful life events, and also some drugs, alcohol, and antidepressants. Coming to the clinical features, we know these bipolar disorders will be having manic episodes and depressive episodes. So what are the manic episodes they will possess? Abnormally and persistently elevated mood. Abnormally and persistently elevated mood that will be lasting for at least 1 week, the patient will be having. And inflated self-esteem or grandiosity. Inflated self-esteem or grandiosity, and decreased need for sleep, more talkative than usual. So manic episodes, abnormally and persistently elevated mood will be there for at least 1 week. Inflated self-esteem or grandiosity they will possess, and the decreased need for sleep will be there, and they will be more talkative than usual. And there will be racing thoughts or flights of ideas in their minds, and they are so distractible, and the increase in goal-directed activity will be there, and excessive involvement in pleasurable activities such as spending money or sexual indiscretion will be there. So manic episodes, I will repeat once again: abnormally and persistently elevated mood will be there at least for 1 week. Inflated self-esteem or grandiosity they will show. Decreased need for sleep will be there, and they will be more talkative than usual, and there will be racing thoughts and flights of ideas in their minds, and distractibility will be there, and there will be increase in goal-directed activities, and excessive involvement in pleasure activities will be seen, such as they'll spend a lot of money, they're having any sexual indiscretion will be there, like whether it is good or bad they will not be knowing, and there will be sexual indiscretion they will possess. And depressive episodes, now we just mentioned what are the manic episodes they will possess. Now you have to mention some of the depression episodes they will have. Depression mood will be there, most of the day will be depressed, and markedly diminished interest or pleasure in all or almost all activities of most of the day. Insomnia or hypersomnia they will show. Fatigue or loss of energy. Feeling of worthlessness or excessive or inappropriate guilt will be there. Diminished ability to think or concentrate or dysthymia. Once again I will repeat: depression episodes that you can know, like the depression syndrome is also there. So the same clinical features will be happening in the depression episodes. That is, most of the day they will be having depression, depressed mood will be there. There will be marked diminished interest or pleasure in all or almost all activities of most of the day. Insomnia or hypersomnia they will possess. They will sleep. They won't sleep, or they will sleep too much. Fatigue or loss of energy will be there. Then feeling of worthlessness. They feel like they are not worthy of anything, or excessive or inappropriate guilt will be there. Diminished ability to think or concentrate or indecisiveness will be there. Coming to the investigation part, the main part of the investigation is to rule out other causes. So we should know what are the other causes that will mimic this bipolar disorder. What are those? Hyperthyroidism and any stimulant drug abuse. So we have to rule out whether the patient is having hyperthyroidism or the patient have taken any stimulant drug or not. So those comes under the investigation part. And the routine blood investigation and other investigations you can do to the patient. Coming to the management, the main 2 drugs that we are giving to the patients are mood stabilizers and second generation antipsychotics. Mood stabilizers and second generation antipsychotics. What are mood stabilizers? Examples are lithium, sodium valproate, lamotrigine. So lithium, sodium valproate, and lamotrigine. What are the second generation antipsychotics? I have mentioned in the schizophrenia module, like there are two types, conventional and newer. Conventional or first generation, or newer or second generation. So newer antipsychotics we are giving to the patient. The examples of the newer antipsychotics or neuroleptics are aripiprazole, olanzapine, risperidone, etc. So mood stabilizers we can give, and second generation antipsychotics. So mood generation example, lithium, sodium valproate, and lamotrigine. Second generation antipsychotics, aripiprazole, olanzapine, risperidone. And also antidepressants. That is, they are sometimes added for the severe depression, but they are not recommended as sole therapy for the depressive disorders. For example, selective serotonin reuptake inhibitors. They are antidepressive drugs. So they are used for the depression episodes, but they are not recommended as sole therapy for the depressive disorder. And also sometimes electroconvulsive therapy, the shock therapy also given to used for the depression refractory to treat, and it is also effective for mania. So the treatment modalities include mood stabilizers and second generation antipsychotics. And the examples of mood stabilizers we have to mention lithium, sodium valproate, and lamotrigine. And second generation antipsychotics, aripiprazole, olanzapine, risperidone. That's it. And antidepressants can be added. What are those antidepressants? Selective serotonin reuptake inhibitors. And electroconvulsive therapy is also useful in controlling the depressive and mania episodes. So I know this is not everything for this section bipolar disorders, but at least this much you have to write whether it is, when it is asked as a 4 marker. It can be asked as a 2 marker also. So bipolar disorders, what is bipolar disorder? The definition you have to write, characterized by mania and depression. And one will be predominant. Etiology factors, you can just mention these 4 points. Genetic factors, dysregulation of serotonin and norepinephrine, stressful life events will be triggering the, and drugs, cocaine, amphetamine, alcohol, and certain antidepressants. Clinical features, you have to divide into manic episodes and depression episodes. You have to mention those factors. You can just think and write what will be there if mania is there, abnormally and persistently elevated mood will be there to that person, and they'll be having inflated self-esteem or grandiosity will be there, and insomnia will be there, and more talkative than usual the person will be, and there will be thoughts and flights of ideas in their minds. They are so distractible, and they'll be increasing goal-directed activity. They'll start some initiative. They'll start preparing for their life and all. That will be there. And excessive involvement in pleasurable activities. They'll be spending so much of money, and they'll be having sexual indiscretion and all. And coming to the depression episodes, there'll be depression mood most of the day, marked diminished interest in all the activities most of the day. There will be insomnia or hypersomnia, fatigue or loss of energy will be there for that person. They feel worthless, and excessive or inappropriate guilt will be there, and diminished ability to think and concentrate, etc., etc. Investigation, we have to rule out other conditions that mimic the bipolar disorder. Here it is hypothyroidism and stimulant drug abuse that you have to rule out by investigations. Management include mood stabilizers and second generation antipsychotics. Examples we know, and antidepressants can be added. Examples, selective serotonin reuptake inhibitors. Electroconvulsive therapy is also useful sometimes. So I guess it's clear, guys. So thank you for your time. Have a nice day, and